Before we start this episode, I wanted to tell you that if you're looking for free dog training courses, you can take the Victoria Stilwell Academy's most popular free course, Building Your Dog's Confidence, right now by going to vsdogtrainingacademy.com. That's vsdogtrainingacademy.com. Okay, now on with the podcast. What is a veterinary behaviorist? To become a veterinary behaviorist, you have to undergo extensive training, including treating behavior cases under the guidance of a board-certified veterinary behaviorist, executing and publishing a research project, and researching and writing 3 case reports. Upon training completion, a resident becomes eligible to sit for a 2-day boards exam covering a wide variety of species and their related medical and behavioral problems. Once board certified, the doctor can begin treating specialty behavioral and training cases in pets. And my next guest, Maggie O'Brian, this comes from her wonderful website. Dr. O'Brian became a board certified veterinary behaviorist in October of 2021. She is very kindly joining us today. I know she is extremely busy, but we are going to be talking about everything to do with veterinary stuff, behavior, like what is a veterinary behaviorist and when do you need to consult a veterinary behaviorist versus a trainer? We're going to unpack all of that. Plus, I'm going to ask Dr. O'Brian a whole load of different questions so that maybe if there is something that your dog is experiencing, either a medical or behavioral related question, that we'll be able to answer that through this podcast. So a lot to get to. Dr. O'Brian, I'm really glad that you can join us. Welcome.
Yes, I'm so happy to be here. Thank you for having me.
I got this. So I started off by saying what a veterinary behaviorist is from your excellent website, but you have your website is Virtual Veterinary Behavior Medicine. And I know you have this virtual business, but you've also got a local business as well. Dr. O'Brian, what does it take to become a veterinary behaviorist? What I've just read from your site is extensive, but I mean, obviously there's a lot more to it than that.
Yeah, so it's like any specialty within veterinary medicine. So I think there's maybe more familiarity with some of the other specialties, like an orthopedic surgeon that is a veterinarian that just focuses on orthopedics, or a neurologist or an oncologist or something like that. But we're one of those specialties. So if you have a dog with a serious orthopedic issue, you go to an orthopedic surgeon. If you have a dog with a behavior issue, you go to a behaviorist. So we get very similar types of training in terms of the commitment and the time of residency and the testing and all of that. Obviously, it's just particular to our area of interest and study. So.
But you are a veterinarian first and foremost. And then do you add that? Do you specialize in that? So you're saying, just like the orthopedist, you will get your basic knowledge. It's not really basic knowledge, but you will do your, I think, is it 5 years, 7 years?
So we'll do typically 4 years of undergraduate after high school. And then you'll do, if you're kind of the more traditional approach, it's 4 years of veterinary school. Oftentimes you'll do a year of either an internship or practice at like an emergency practice or something like that. And then you go back after veterinary school and after undergrad to do a 3-year residency. And the time frame of the residency varies, but I did mine in a university. So those are most standard going to be 3 years long. So it's a long.
So you're talking about nearly 10 years, 8 to 10 years of education before you can start practicing.
Yes, as a boarded behaviorist. Yes, it's a lot of time in school.
That's a lot. And I would think quite expensive, isn't it? I mean, to become a vet in itself is expensive.
Yes, we have our debt, but luckily the dogs are cute and the cats are cute, and they make it worth it. But yes, it is not an inexpensive path, certainly, to take. But
I want people on here to realize just how qualified these veterinary behaviorists are and how they are so important to trainers like myself. And I know that trainers in my network and other trainers that I've spoken to that rely a lot on veterinary behaviorists as well. But unfortunately, there aren't a lot of you.
No, there's right around 100. We had a kind of a large class just come through and take their boards, and many people out of that pass. So we're getting a little bit bigger, but as compared to the other specialties, yes, we're very small. There's still large swaths of the country that do not have any access to a local veterinary behaviorist, which is not ideal for the people living in those areas, particularly if they're, more populated areas with nobody, or if you're in a less populated area where you can't reliably get to someone close to you. So yes, we wish we were bigger in numbers. But
yeah, I mean, and you're talking nationally. You're talking about 100 board certified veterinary behaviorists in the United States of America. That's it.
Yeah. And not all of those people are going to be practicing in a clinic setting where they're working with patients or working with pet parents. So some people are going to be in an industry setting or a shelter setting. So that's going to spread people out a little bit as well and limit availability for people.
Is this the reason why you have virtual veterinary behavior medicine? So yes, it doesn't matter where in the nation anybody is, they can access your services.
Yeah, the biggest hope is to expand access to care because there are so many areas and so many people that just don't have the access to the care that they need. And luckily, I think the awareness of veterinary behaviorists is getting more and more kind of prevalent for people, and either through their trainer that knows that this is a person that they should see or a specialty that they should see, or their veterinarian, getting the word out to those people and letting them know there are people who are offering virtual care. So you don't have to travel hours, or, you don't have to delay care or just never see a veterinary behaviorist due to your location. So that was the biggest goal, is definitely expansion of care.
Okay. Well, thank you so much for kind of laying that out so that we know exactly kind of where we stand and how important you guys are and how few you guys are. But as I said, trainers like myself, we rely on veterinary behaviorists a lot, because if we have a client where we think not just something medical is going on, but where we think something else is going on that shows that this is not just, and I don't want to say normal or abnormal behavior, but this really needs to have a more than just a training approach or just a vet approach. This needs to have a veterinary behaviorist look at it. So what are some of the behaviors that you deal with on a regular basis?
So most commonly we'll see aggression, I'd say, is the number one problem that we see, likely just due to the liability and safety concerns. And that's going to be the one that's going to push people towards feeling like they can't have the dog in the house anymore, have the cat in the house anymore. So we tend to see aggression as the most common issue, but we'll see things like compulsive disorders. We'll see things like fighting between animals in the house, issues with senility or cognitive decline in senior dogs. See dogs that are just very anxious. So they just have an inability to settle, to focus. And when you talk about training as a piece of their plan, those are the guys where you're doing all the right things, but you can't make as much headway as you would hope because the dog is too vigilant and they can't focus or they can't retain things. Not because they're not smart or the person's not good at training. It's just that they have underlying emotional disorders that are kind of stalling progress.
That's why I think the tragedy of the whole world of training, not just in the USA, but the whole world of training, which is so polarized anyway, that's where the tragedy lies, because we're trying our best. Even the positive community, we're trying our best, and we're trying to know that time of when, look, we need to refer, because everything that we're trying to do, all of our protocols and everything that we're putting in doesn't seem to be having that much effect, because as you said, the dog is too hypervigilant, too stressed out, just is not able to get into a place where they feel comfortable, safe enough to learn. And that is where you start to go, I think there's something more going on. Hopefully you do that before you've set up a whole protocol. So I always tell my students, hey, never go above your pay grade. If you think that there's something going on, refer, know when to refer. So my question to you is, when do you know when to refer? Because there are a lot, I mean, there's a lot of clients on here. There's a lot of just regular dog lovers, but we also have a lot of trainers and other animal care professionals on here as well. So if they see something, what are those signs that they should be referring to a vet behaviorist?
Yeah. And it's always a collaboration too. So when people do refer, it's not like a transition of care. It's just kind of bringing another person onto the team. And so when you look at it that way, we always prefer sooner rather than later. So we when we see cases, it's certainly more often that it's, I wish I'd seen this dog a year ago versus I don't think this was necessary. Those cases almost never, honestly, I don't know that they ever happen. So the sooner the better, but kind of some hallmark things would be aggression, particularly in a younger dog. So if you're starting to see problems in your, 9, 10, 11-month-old dog where they used to be shy or frenetic in new situations and now they're starting to grumble or stare, those guys were really worried about what the next few years look like for them as they go through social maturity. So we'd love to see those guys before they enter that stage so we can set them up for success. A lot of the dogs we see have comorbid medical issues. So if we're suspicious of pain, if it's a newer behavior in a senior dog, that's always going to kick off some alarm bells. Anything in puppies, because it's abnormal to see a really young puppy with a significant behavior concerns. We like to jump on those guys as quickly as possible. Cats are excellent in hiding physical pain because they're excellent predators, but they're prey animals. So anything that we have suspicion would be related to a medical issue. But anything aggression, anything that's going to be a bond breaker that we think is, the owner is not going to be able to keep this pet in the house for forever, or if you have really stalled training progress as well. So if you have this plan, the owners are following it and we're just not making headway. Those are the guys that we oftentimes see.
I know I've definitely had experience of seeing puppies at a very young age showing quite a tendency to resource guard and to show quite overt behavior, quite worrying behavior, very young. Then that always makes me go, oh, I don't think this is not, and I put it in quotation marks, this is not normal behavior. It seems to be very abnormal to me. And that's when I will reach out to a vet behaviorist as well, because I think there is something else going on here. So let's say you get a puppy that seems to be a resource guarder. And I mean, I'm talking from very, very young age, like even sometimes we see it about even 8 weeks, 9 weeks. What's going on there? Is this genetic predisposition to be a resource guarder? Have they had already that learned experience of having to not being able to get to the food bowl or having to fend other puppies off the litter mates? Like what's going on that makes a puppy become a resource guarder so young?
So likely a combo of all the things that you just said. So resource guarding is kind of the unique exception to the generally it's abnormal to see aggression prior to a year of age. So a dog that's growling at strangers, that's growling at the vet, that's getting super mouthy or stiff with the owner when they try to pull them off the furniture, that anything before a year is a massive red flag. And we like to see those guys ASAP. Resource guarding, while we do like to see those dogs as soon as humanly possible, it is more typical to see that around 16 weeks. So that's kind of when that issue can crop up in certain dogs. So it's the little outlier that you can see earlier. Genetics can absolutely play a role in that behavior. There's some genetic studies that are going to point to certain breeds or groups of breeds being more inclined to have owner-directed aggression, which often falls under the similar categories, resource guarding. You'll see, a dog that was part of a massive litter as a puppy that may have not had as much free access to food. And then you'll still get really common recommendations, even in the veterinary community, certainly online, where people are taking dogs' food while they are eating it, messing with their food, petting the dog a bunch while they're eating, taking bones away from them. And we know all of that is also more likely to lead to resource guarding. So, trying to very quickly put the brakes on those sort of interventions that people are doing with the best of intentions as soon as possible to try to reverse some of the concern that we've got building in those dogs.
As we know, there is so much information online, so much great information and so much appalling information.
Yes.
One of those being, hey, you need to be in charge of your dog's food bowl. We were all taught that. I mean, I've been doing this for nearly 30 years now. We were all taught that. We were all taught that, you should be able to take your dog's food bowl away, stick your hand in your dog's food, and you should be able to take a toy away. You got to show the dog that they're not dominant, that you're dominant. We know that all of this is just comes from, I feel like, really human insecurity, but just lack of knowledge, lack of education. And we now know that that can cause a lot of issues. It can cause dogs to feel really unsafe. And how would you feel if your dog suddenly comes and puts its paw in your food or takes away your stuff? I mean, you are just building a wonderful resource garter right there. So what can we do about this misinformation? Well, first of all, I'd say go to positively.com, because that's a website that you can truly rely on to give you the most updated and the best kind of information you can get. But what can we do to combat this information? Why are we so fixated on the fact that we have to show our puppies who are boss, and we have to be able to put our hands in their food and to take toys away from them? Where does this come from? And what does it look like from the dog's point of view when we do that?
So I think the big kind of broad question is kind of battling misinformation online or through, certain avenues. And that's obviously not just limited to veterinary behavior or veterinary medicine or dog, that's a problem in every field, that's out there. But, the more that we can educate trainers, obviously, and then the more we can educate, I think, primary care owners who have those conversations with the puppies at the first visit, and you can get ahead of it and say, hey, just as a reminder, we don't want to be messing with their food. We don't want to be taking food away from them or petting them while they're in the middle of eating, or take bones away from them, and just some kind of basic guidelines for people as they go through those puppy visits. So, we try to get more and more education into veterinary schools on behavior, because it's really hit or miss still on which schools get behavior education, despite it being such a big part of helping take care of pets and families. But just trying to get the information out there, ideally before people start to implement those, again, well-intentioned but inappropriate interventions. And then certainly when issues pop up, having the correct avenues to go to get quick help and quick recommendations that are appropriate.
I think it is understanding the dog's experience. I had a client that, and you'll be able to see this on the Dog Academy, the second series that's coming out in the UK next year. But I had a client that did not like being touched. It seemed, I mean, I don't know, I can't look inside the dog's brain, but definitely the behavior seemed to be just don't bend down and touch me. There definitely was some issues going on with the dog's hips that they hadn't seen, so they took the dog to see their veterinarian, which was great, and then a specialist, and so found out that there was some hip dysplasia as well. But it was this focus on being able to take toys away that really had impacted this dog's life, with a very few simple changes, which I can't go into now, but of what I did. But I'd like you to tell people, Dr. O'Brian, about what you would suggest with a very few simple changes for this lovely, lovely couple that love their dog like anything. A very few changes that I'd say made this dog feel safe, that they weren't a threat. The dog's life and their lives completely changed. So let's say you do have a dog now that's exhibiting this kind of behavior. What would you suggest?
So really basic things that people can do is definitely immediately stop messing with the dog while they're eating, so that when they eat, it's their own time, their own space. We leave the dog alone. We don't hover near them, pet them, put our hands in their food. When we see dogs for resource guarding, I find that people, obviously, they really want to help. And so they'll even do things like grab treats and add it to the bowl, but they'll do it in a way where their hand is right next to the bowl and it's making the dog more suspicious. So kind of as an immediate recommendation, we say just hands off, don't mess with the dog, leave them alone. And then other things that we do are if the dog gets something that is not valuable or not dangerous to the dog. So if they're starting to steal certain items like a sock or a tissue or things like that, we emphasize ignoring the dog for those sorts of things so that it doesn't turn into this, I have a sock, I'd like a treat, please, because that can be bothersome. So we try to ignore what we can to reduce attention-seeking types of stealing, which can shift towards resource guarding in some dogs. And then if it is dangerous or valuable and we need the item back from the dog, we'll do trades. And I, again, emphasize that's not, I take the thing from your mouth and give you a treat. That is, I'm going to throw chicken or something across the room. Once you've dropped whatever you have to go get the chicken, I'm going to pick it up. So it's very non-confrontational. Then I always recommend that if they want to work actively on things like drop it, leave it, that they work in conjunction with a trainer under the supervision of a trainer, because I find that it's challenging for a typical pet parent to correctly implement those things without making the dog more nervous. So I always say we can work on drop it, leave it. If you've got kids in the house, you really want to make the dog less suspicious and not just focus on management, then I say we want to connect you with a trainer to work on these things with directly.
And that's where the collaboration is
Yes.
vital.
Yes.
That's where it really works. It's sort of like the dream team.
Yes.
I always believe that every client needs to have a support system, whether that is a support system of a dog walker, a great vet, a great veterinary behaviorist, if needed. I mean, I think that support system helps those clients, it helps those dogs, and we can get a good resolution from pretty much, well, a lot of different behavior issues that, I come across. I do feel like the team is the best way to go. And then if you set up a team for the rest of that dog's life, at least that those people know that they're being supported, especially if the dog does have needs that we need to constantly address and keep constantly addressing. So it is at a manageable and safe level. Okay, so other issues. Now, I'd like to get your take on this, because keeping on the subject of aggression, there is lots of labels. People label aggressive behavior, territorial aggression, dominance aggression. Talked about resource guarding. People have called that possessive or possession aggression. And that all of these labels that we're using for this behavior, what do you think about the labels? Are they accurate? And how would you describe what's going on inside a dog's brain when they are showing aggressive behavior?
So there are certainly different names for the same thing, or there's, we don't have a DSM the way that psychiatrists do in human medicine, which is definitely a drawback because we don't all use the exact same languages. Even amongst veterinary behaviorists, we don't always use the same language. There's obviously a lot of overlap. So fear-related aggression is going to be one that everyone uses. Conflict aggression, which previously was thought of more as a dominance issue. And conflict aggression is aggression towards family members for circumstances that a dog perceives as a threat, even if it's not a threat in our reality. So there are overlap. Aggression in general, we think of as a distance increasing behavior. So it's a way to create space between the dog and something they find threatening. You can see that distance increasing also be more of a, I'm going to get to you before you get to me. So it's still coming from a place of threat, but that's your dog that is leash reactive, gets loose and does run across the street and aggress towards that dog. Because that, from a distance increasing standpoint, you're like, well, why'd you run across the street then? But that's more of a, I'm going to get to you before you get to me because I find you very threatening. So aggression in general comes from a place of feeling threatened or perceiving threat and then needing to move the threat away from them. And then when it gets those different titles, it kind of applies to the circumstances around the aggression.
So let's focus on conflict aggression, because that has been known as like the D word, dominance.
Yes.
As in when a dog has conflict aggression, actually, the dog is trying to be dominant. The dog is trying to control the environment and show that it's top dog, show that it's boss, so it's the alpha, yada, 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 all of that stuff. And we know, well, again, that's kind of almost a human construct, I think, from an insecurity and a lack of understanding of how to explain this behavior. So please explain the behavior. Why would a dog be conflicted? And why should we be really careful of that word dominance?
Yes, I love conflict aggression. We see it all the time. It's one of my favorite things to talk with people about. So conflict aggression is aggression towards human family members or someone that's very familiar with the dog. Usually it's someone living in the house, over an interaction that a dog perceives as a threat. So very commonly, it's going to be pulling the dog off furniture. If we're scolding the dog, resource guarding kind of fits nicely under that. So we kind of call it "I like you, but." So it's "I like you, don't pull me off the furniture, don't pet me when I'm sleeping." All of that kind of criteria that they have, and the more potentially abnormal the dog, the lower their threshold may be for that. So you might get a dog that, finds it threatening when the familiar person walks into the room, right? That's not a real threat, but for whatever reason, the dog is perceiving it that way. But it's typically specific interactions like petting them when they're sleeping, moving them, trying to mess with them when they have an item that's there. So all of those are the more common triggers. And to your point, the dominance approach is incredibly problematic with that specific behavior problem, because that behavior problem comes out of the dogs perceive the owner as a threat. And oftentimes when people label a dog as dominant, the direction for the owner is, well, you need to be in charge and you need to, be domineering back to this dog. And then that's just going to build the confrontation and the level of conflict, and oftentimes will snowball the problem, as opposed to kind of taking a step back, saying this dog's perceiving threats and is scared of things that he shouldn't be scared of. Let's be the human in the situation. We'll let the dog be the dog and kind of work with them rather than against them to try to lead to a safer and happier home.
I'm really glad you explained that, because I don't think people truly understand just how damage that dominance word has done to our dog training industry as a whole, with trainers really, their brands are really focused on that. Don't let the dog dominate you, make it surrender to you. And that their whole brand, their whole identity is the battle with the dog that has to be won at all costs, which is terrifying. And again, I called it a tragedy. I'll call it again because it is. It's tragic for dogs, because then, of course, that leads to a lot of pretty punishing behavior from humans towards dogs. And we're working really hard to try and even this podcast is helping to try and put out the right kind of information out there to people. Okay, so you have a dog that is showing conflict aggression. What do you do about it? Let's say, and look, it's happened in my house when I had my daughter, who knows? You don't go and approach my Chihuahua and try kiss her on the head. You just don't. She doesn't like it. But when she's a teenager, teenagers can do what they want because they're invincible. She doesn't do it now. She's older, but she can do what she wants because she's invincible. So she will go and put her face next to the Chihuahuas and try kiss her on the head. Well, what does Jasmine do? Jasmine says, "No, you don't," and tries to bite her. And then my daughter's all offended. What did I tell you? Look, if a teenager who knows and understands dogs, who's grown up with a trainer but is invincible, I want to do this because I want to show affection to my dog and she loves me. She spends all of her time with me. I should be able to do this. How can we get the message out to people that we have to respect the dog's experience of the world and their space? How do we do it, especially with kids?
Yes. And yes, kids definitely add a level of complication to conflict aggression. So it's a tough combo. Conflict aggression and success of treating that problem hinges on people's ability to follow rules. Yes, these dogs typically benefit from medication. Yes, they benefit from training. But at the end of the day, there's typically, without extensive training, there's just a list of things we don't do with them. We just know, hey, in this particular dog, whether it's genetics, whether the dog is painful, they just, like you said, they just don't like these certain interactions. It's not that they have no rules and they do whatever they want, but we can work with them and not against them. And how do we both kind of win at the end of this? So that's what I tell people. The conflict aggression is never going to be successful if it's a we win and the dog deals with it. It always has to be an everyone win. So it's avoiding conflict. If you've got to move them off of furniture, rather than pulling off, we use a treat or a toy or teach an off cue. People find it very challenging to say off in a nice tone. So we typically try to change the word to mangoes or something that you can't yell angrily at a dog. So it's just, that would be an example of we still get the same outcome. The dog's off the couch, but we avoided conflict. And these guys are just not ones where you can just keep saying, no, I'm moving you off the furniture and pulling you by your collar. They're just not dogs that are ever going to do well with that. It's not in the cards. So we work again with them and not against them.
And that is really smart. Not bringing conflict into the relationship, removing conflict, but we live in a world full of conflict. We live in a political world full of conflict. And now it's got even worse, where conflict is celebrated and dominance is celebrated. So what can we do to get people over to the side to see that actually what we're doing is not just kind of being soft or treats and toys is all very well, but you've got to show this animal where their place is. How can we combat that?
My approach is always just emphasizing we want the safest and happiest dog. And the good news is, despite what owners have previously done, and usually at the direction of someone who is not giving them appropriate advice or going again online and finding the wrong types of or pockets of information. But typically they want the same thing we do, which is they want to keep the dog in the house. They love this dog. They want to not be bitten or snapped at. They want the dog to be happy and they want to be happy. And then we know this is just the best path to make that happen. And so vast majority of the time, people are, I would say, very receptive to that approach once it's framed that way. We're not, like you said, we're not just trying to be soft or be crazy gentle. That the goal is a positive outcome. And this is the best way to make that happen. And so, and oftentimes all the things they've tried that are aversive aren't working anyway. So I say, hey, worst case scenario, I just say, hey, you know what we've been doing isn't working. Let's just try this. Let's see where it goes. And then inevitably it goes better. So
I love that. That's a great answer. Thank you. Okay. After the break, I'd like to talk about compulsion behavior. Behaviors that you see like spinning or air snapping, chewing, chasing a tail, licking that is just doesn't stop. I'd like to talk about that. So we're going to come back with Dr. O'Brian after this break. Have you been trying to find the right time to level up your professional dog trainer skills, knowledge, and certification? We built the Victoria Stilwell Academy's professional dog trainer course for people like you, and we've purposely designed it so that you can start whenever is most convenient for you. Or are you looking for how to begin as a professional dog trainer and don't know where to start? The Dog Trainer course guides you through the learning process from A to Z, delivering a powerful yet flexible experience, resulting in VSA's prestigious Certified Dog Trainer certification. Or maybe you're already a trainer, but feel there are a few holes in your skills and knowledge. VSA's flagship course contains all of the knowledge and skill-based assessments via your own dedicated faculty advisor to mentor you through the course and help build your confidence to be an elite dog training professional. Or perhaps you already run a pet business as a dog walker, a sitter, daycare, groomer, or your veterinary staff, and you want to be able to provide the clients who already trust you with certified training and behavior services as well. No matter where you are on your journey, the Victoria Stilwell Academy's Dog Trainer course is here to help you chase your dreams as a professional dog trainer. Our friendly, accessible team is available today to talk with you and help you determine whether VSA is the right fit for you. Or you can enroll in a completely free starter course right now to test drive the VSA Student Learning Center for yourself. And as a special holiday bonus, if you apply for registration using promo code HOLIDAY, we'll give you the largest special bonus package of add-ons of the year worth more than $1,000 or £800. With promo code HOLIDAY, you'll get a Positively gift card worth up to $250, a free registration to the upcoming Dog Behavior Conference, a free year of Positively TV, a personalized signed book, and a free private one-on-one coaching session with me. Just visit vsdta.com to get in touch, enroll in a free course, or apply now. That's vsdta.com. Again, go to vsdta.com to learn more now. I can't wait to see you in class. I'm back with Dr. O'Brian. We're going to talk compulsive behavior now. Okay, you've got a dog that's chasing its tail. You've got a dog that can't stop chewing its tail, constantly snapping at the air, constantly staring at something and not breaking that stare. All of these behaviors that we look at and go, oh, this is weird.
Yes.
How do you explain it?
So compulsive disorders are definitely a very interesting section or subset of behavior problems. They're typically going to be very repetitive behaviors that are very difficult to interrupt. We can't identify a trigger by the time they're kind of called compulsive disorders. You can't really identify why the dog is doing the behavior. It doesn't follow a particular pattern. And then again, they're usually repetitive and they're really hard to interrupt. And then they can cause the dog to have a more difficult quality of life because they're doing this behavior at the expense of more normal things like resting or playing or socializing. And so they're definitely a large concern for the dog and then subsequently the whole family. The big thing about compulsive disorders is that many of them have overlap with medical concerns. So we are often doing follow-up testing for these dogs depending on what they're presenting for. So your tail chaser, we are concerned, do they have some sort of neuropathy where, their spine hurts or they have nerve sensations that have created that kind of behavior pattern. It's more common in breeds like German Shepherds, where you're also more likely to see spinal issues. So we always want to be looking for potential medical issues. If a dog licks the floor, licks the walls, if they're eating things that are not food, which is called pica, we start to worry about gastrointestinal disease. So we like to work them up further for that area of concern. So they're always really interesting cases because there is overlap with medical issues. They do often need a medical approach, but they also need a behavior approach in a large way too, because it is a significant behavior problem. So it's definitely, when you talk about like a team approach, that one's very, very much a team approach.
And that brings me on to medication.
Yes.
Many of these dogs will benefit from pharmacological support. A lot of people do not want to give this type of medication to their dogs. They don't want to give it for aggressive behavior. They don't want to give it for this type of behavior. They are worried that it will change their dog's personality, the character, that it will make their dog sleepy. Can you bust some of these myths out there about the use of medication?
Yes. Broadly speaking, the goal with medication, and there's two different categories. So you're looking at fast-acting medication or as needed. So those are things where you might use them before a veterinary visit or before July 4th, just like some people take medication before public speaking or before getting on an airplane. Those medications have a big wide dose range. If it's a once in a blue moon event and the dog is going to be traumatized, we'll tolerate sedation for that specific event if we need a higher dose. The other category, which we do very often talk about when we deal with an aggressive case or a compulsive disorder or an animal that's marking on the walls of the house. That category, we're talking about long-lasting daily meds. So those are typically pulled from antidepressants in people. They take 4 to 6 weeks to work, but the goal at the end is that you have a dog that is less impulsive, specifically if you're talking about aggression. You have a dog that is less vigilant, is better able to learn. But the only acceptable outcome we talk about with owners is a happier and a safer dog. And if that's not what we get, we wouldn't keep the dog or the cat on the medication. So I try to get ahead of some of those concerns because, like you said, people, they don't want their dog to be a potato in the corner. They don't want their dog to lose their personality. So we always preface it by saying, hey, your pet doesn't know they're on meds. They can't tell us how they feel. So at the first sign that we're concerned that we are having any one of those unwanted effects, we take the dog off the medication. There's no commitment to say, if we start this, we're keeping them on it for 6 months and that's it. We can pull them off a week later. We can pull them off 6 weeks later. So if we're not getting that happier, safer dog, we don't keep them on it. If we see sedation, we don't keep them on it. If we get, less playful dog, we don't keep them on it. So we try to get ahead of some of those very normal fears that people have.
You're saying a lot of these, like Prozac, for example, fluoxetine is one of the big ones that gets prescribed. Even my dog, Jasmine, was on fluoxetine for a time. And the reason being is because there was definite behavior changes after our other dog passed away. I do believe she was grieving. Yeah. She became very, very sensitive, very noise sensitive. I do believe there was pain there as well as she's getting older and older. So we're trying to tackle it from every situation. She's on Librela. She's on, various medications that help her. But she also was definitely grieving the loss of Bella. And it made going outside she'd lost. I mean, she's got her anchor me, but I'm not on the ground. Yeah. She liked to go sniffing with Bella. And so the veterinarian thought, and I definitely agreed with her, that I thought she could do with some of that support. And it really, really helped her. Yeah. Even I knowing a little bit more about certainly the Prozac medication, because I've definitely worked with vet behaviorists that we've put dogs on. They have put dogs on Prozac. Remember that trainers out there should never be saying what medication your dog should be on. If a trainer says, well, I'll give you a prescription for this, they can't. They can't tell you what the medication is, and they absolutely cannot prescribe it. They can say, I think your dog might benefit from medication. You need to go talk to your vet or a vet behaviorist. So I would just say that. I never, ever say your dog should be on Prozac. No. But I worked with my vet to say, I think Jasmine definitely will benefit from it. She did. She wasn't on it she was on it for about 8 months, I'd say, to a year. And then we gradually took her off. And again, not me, the advice from my vet. And she's gone back to the old Jasmine, but she needed it at that time because we were all grieving. Jasmine had lost her best dog friend.
Yep. Yeah. And we'll definitely get cases like that where it is, and the loss of another pet or a big upheaval in environment are really good examples where it is more of a temporary, like get them through this phase, just like there might be people who might need, psychopharm help for a period of time due to some sort of stressor. And then there's other dogs that may benefit more long-term. I always say it sounds like they're out on probation, but we want 6 months of good behavior before toying with changing meds if we feel like we're in a good spot. But once we get to that point, we always have that conversation of, hey, do we want to start to wean? And some people are like, heck yeah, let's try. Other people are like, nope, we're not touching these meds. Which is fine too. So it just depends.
I was a little worried about Jasmine's kidneys, and that's why we thought, because her kidney values weren't great, that we would sort of to wean her off it. And thankfully it was a decision. It was a right decision. If it hadn't have been the right decision, then we probably would have visited it again. But for us, it really helped her. And my dog was on Prozac because she was grieving, because she had lost her anchor on a walk, because there's no one. I mean, she snuggles up with me all the time, but when I'm not there, who does she snuggle with? So I did buy her Arthur, and Arthur it's a beagle, and a squidgy beagle that she can cuddle up to, and she absolutely does cuddle up to Arthur, the toy beagle. But she needed that, and that's I was really focused on seeing, what does this dog need? What is she lacking now, and what does she need? And so that was successful, and I'm so glad that we were able to get her through that really difficult period of all of our lives, but of her life especially, to the point where she is now. Okay, elderly dogs. I'd like to pivot to that. You mentioned cognitive decline in senior dogs. Does it look like dementia in people? How can you tell that there is some cognitive decline going on with your senior dog?
So there is a lot of overlap between what we would consider Alzheimer's in people and then what we would consider canine cognitive dysfunction or cognitive dysfunction syndrome in dogs. So they have the same brain pathology, which is really interesting. Dogs will get used as models for that disease to look at certain treatments that might work for people. So there is a lot of overlap. The main things that we see from a clinical perspective is, and we'll use the acronym DISHA usually, but it's disorientation. So that might be the dog trying to go out the wrong side of the door when they know how this door opens for 10 years and now they're going to the hinge, or they'll stare into space. You'll see changes in interactions. That's the I of the DISHA, is either being way more clingy, or sometimes they're just more content to hang out in the other room for hours when they used to always want to be right next to you. You'll see changes with house soiling. So that's going to be, they might go to the bathroom in the house after they were just let outside. Changes in anxiety with either separation or just general anxiety. Sometimes that'll be more prevalent at night, which is also more common in elderly people, where they'll get pacey or panty towards the end of the day. And then there's kind of a host of other issues like loss of learning or loss of learned tricks or things like that. It's hard to tease out from medical problems. And again, oftentimes it's just a collection of, I wish we could say this is the problem your dog has, but pain will also worsen a lot of those things. So pain will make dogs not as readily able to settle, or maybe they don't want to, if you have a cat and the only litter box is on the second story, maybe they don't want to go up the stairs to go to the bathroom. So we always try to tease out to the best of our ability what is a medical concern, what is cognitive decline, and oftentimes it requires, approaching them from multiple different angles. But it's very common for people to feel like their dog or cat just has old age and there's nothing to be done about it. But we can do a lot to help slow progression of cognitive dysfunction. So we like to address it. We like to start screening for it at 8 years so that we can.
At 8 years old.
Yeah.
Okay. Now, when it comes to nutrition and cognitive decline, what role does things like coconut oil, MCTs, play in available glucose in the brain?
So there are studies specifically with things like DHAs or different types of, oh my gosh, my brain isn't working well enough. But there are studies with different ingredients like that, or MCTs or different things, or amino acid types, where they've shown with certain prescription diets that you can slow aging changes. Oftentimes they do best if pairing those diets with things like regular training. We kind of talk about it like it's doing your crossword or your Wordle, but you want to cognitive decline. You want to hit them from the training side, from the nutrition side, sometimes from a supplement side, sometimes from a medication standpoint. So all those things together can be helpful. And diet's a fairly easy thing. If you need to switch your dog to a senior diet anyway, you can switch them to a diet more aimed at cognitive decline.
So you're talking about really preventative care from about 8 years old. You're sort of anticipating it and you're putting those things into effect, taking a look at it, screening at 8 years old, so that the dog is moving into being a senior dog at that age, isn't it?
Yes, we like to be as proactive as possible. So we like people to start the senior supplements ideally at the age of 8. The problem with, or I shouldn't say the problem, but the challenge with dogs is that a lot of times we don't see cognitive decline until it is fairly advanced, till we get the dog that stares at the wall or gets stuck behind the couch and can't figure out how to navigate out of it. Unless you have a really high level training or working dog where they're a little slower on tricks, or they're not following cues as sharply as they used to, unless you have a dog that's, we have that connection with, or that awareness of what's going on in their brain, a lot of times we just don't see it until it is more advanced. And at that point, we can absolutely still help, but we're a little bit behind the 8 ball. So we like to just say, hey, we know risk starts around 8. Let's just start setting you up for as much success as possible.
Okay, great. And because it's the holidays, the last question I ask, and thank you so much. I'm like just firing questions at you. I didn't even give Dr. O'Brian any questions before this podcast started. I don't normally do that because I just like it to flow, but this is great. It's holiday season. A lot of people are traveling, taking their pets with them. Pet doesn't like being in the car, shaking like a leaf, doesn't like being in the airplane. What can we do? Are there medications that we can give our dogs to help our dogs go through those transitions?
Yes, from a medication standpoint, there's supplements, there's prescription medication depending on the severity of the issue. So, there's a lot of kind of calming supplements on the market. Some are from bigger name companies that we find a little more, we have more awareness typically of what they're putting in their products. So there's those supplements. And then there's certainly prescription medication that we use. I'm not a rep for any of these companies, but we use a lot of Stilwell for travel, which is especially for car rides, which is actually a gel that's labeled for thunderstorm fears in dogs, but we use it for car rides quite a bit. It doesn't last very long. It's a 2-hour medication and it works within 15 minutes. So it's a really nice shorter acting. There's obviously your tried and true like gabapentin, trazodone, clonidine. There's a lot of fast acting options for us. Environmentally, we like to try to set the dog up in a basket or a hammock or a cage sometimes in the back of the car where they can feel more secure and like they're not going to fall into the abyss in front of the seat. We'll do frozen food toys to keep them occupied. We have them talk to their primary care. We'll prescribe things for motion sickness if we feel like that's an added concern to why they're so worried in the car. If you're an angel, you can play classical music for them in the car. I find it a risk because I would drive off the side of the road because I get too sleepy. But if you're wide awake and you like classical music, that's also kind of a nice thing you can add. Fantastic. Or reggae. They've both been shown to reduce stress.
Yes, they have. Actually, reggae is a big one.
Yes.
And I mean, I think reggae really kind of gets you, I love it. I absolutely love it. And it kind of gets you in the zone. Yeah. And I think it does the same with animals as well. Yeah, it's interesting. There has been research on that as well.
Yes.
So thank you so much. I really appreciate you answering my questions. I'd love to have you back on again as well, because I've still got like a massive laundry list of questions to ask you. But thank you so much. Now, people are like, okay, I need to contact you. You can, because she's virtual as well. So where do they go? Where would they contact you?
So if they happen to be in Charlotte, North Carolina, our practice is Southeast Animal Behavior and Training. So if you're in the Charlotte area, that's the best way to reach out to us for help. Virtually, we're on Virtual Veterinary Behavior Medicine. So it's VVBM. So it's just the acronym .vet, VET. So we have contact information there. If you have any questions, if you're interested in setting up a consult for your pet, or if you're a trainer or vet and interested in referral, always welcome to answer always happy to answer any questions or concerns that people have. And just want to help the cats and dogs out there. So you shout out if you need us.
Yeah, I mean, obviously we focus on dogs, but let's not forget the cats out there.
Let's not forget
the cats. Yes. The cats always seem to be the difficult cousin out there, especially amongst our dog people. But let's not forget them. I'm a huge lover of cats as well, and they need our help. They seem to be, yes, they're more independent, but they need it too. So let's not forget them. Thank you so much for joining us, Dr. O'Brian. And as I said, I'd love you to come back at some point to answer some more questions. And that's it for this week's podcast. Thank you for everybody for listening. We really appreciate your time. I know I really do. I say it every week, but I do have the best guests on here. Thanks so much, and take care of yourselves, and I'll see you on another podcast.
Thanks for tuning in to Victoria Stilwell's Positively Podcast. For Victoria's online dog training courses, more information, and helpful dog training tips, visit Victoria's official website at positively.com. Get connected on Facebook, Instagram, and other social media as Victoria Stilwell, and follow her on Twitter at Victoria S. Learn to become a professional dog trainer with the Victoria Stilwell Academy at vsdogtrainingacademy.com. And be sure to tune in next time as Victoria helps you and your dog live your best life together, positively.